Hello and good evening. Once again, we are over here to talk about USMLE today. Right? In last session, we talked about next and we also talked about PLAB. One interesting question which was asked last time. So that was when we said that for PLAB, you require IELTS to be cleared. Right? That was the question. What should be the passing score? Now, this is very important. The passing score should be say 7.5 overall, but minimum of 7 in any of the four sections, right? In all of the four sections. So there are four sections into IELTS, that is speaking, writing, listening, and reading. So what I mean to say is that even if someone's score is 8, overall score is 8, but in one of the section, if he or she has scored say 6.5, so then this person is not eligible for PLAB. Very clear, right? So it is like the overall score should be 7.5 with minimum of 7 in all of the areas. Minimum 7. Right? This is one of the important thing to be clarified. Yeah, it was a good question, right? I got it on email also, and it was there into the comment section also. So that's the answer of it. Though I have answered it in comment section, but still I thought that let me talk about this. Okay. So this is our today's topic, USMLE. Right? For those whom we are meeting for the first time, I am Dr. Bankim Jani, and in association with Vishwa Medical Admission Point, now onwards we'll call it as VMAP, right? We are over here to talk about all the competitive exams. We are meeting every Wednesday, we are meeting on Saturday, we are meeting on Sunday. Wednesday and Saturday it is at 8 p.m., right? The chat is kept as on so that you can ask any of the questions even directly also. On Sunday, we shall be meeting at 11 a.m. in the morning, especially if the parents they want to join and parents they want to ask any of the question. The idea is in this case is that it is the journey. Medical is a journey. It is like a marathon, right? It is not like a sprint. So for success of every medical student, it is very much necessary that their parents should also know about that what my son or what my daughter is going to do. This is the reason why we are planning it on Sunday, especially for parents, because once they know that it is their responsibility, how much they are supposed to contribute, it becomes much easier. Right? It will be much easier for the students. And what I discuss on Sunday, that is purely based on those hundreds and hundreds of emails received where students have shown their pain that this is what they face, right? That's why this session was planned, right? Every Sunday we meet at 11 o'clock, 11 a.m. in the morning. So be tomorrow, so be present, right? You'll definitely be say benefited. Okay, so let's start with our today's topic. This is USMLE. Why this is considered as a most difficult exam on this planet? It's not most difficult, but it is very systematic exam. USMLE stands for United States Medical Licensing Exam, right? Medical licensing exam. In simple words, if you want to practice in US, you have to appear for this exam. But is it only for US? No, it is like it is valid in so many countries, right? If we very briefly say that what was the next? Well, next is that exam, National Exit Test, if you want to practice in India. Is it valid anywhere else? No, it is valid only in India. If you want to practice, then it is to be given, right? If you want to practice in India. For whom? Everyone. What do we mean by everyone? We mean by everyone over here is that those students who have passed MBBS from India or those students who have passed MBBS from abroad, they are called as the IMG, that is International Medical Graduate. Both of them are supposed to appear for next if they want to go for post graduation or they want to practice in India. Clear? Similarly, PLAB that was for if you want to practice in Switzerland or UK. USMLE, name itself suggests US, right? But let's see what it is. Now this USMLE exam, it is divided into 3 steps, right? All the questions, all the licensing, all the registrations, their site, how to find out your college, everything will be shown. Okay, so these are the steps. Step 1, step 2, step 3. In national exit, we saw that it's a 3-day exam, but then it is done, right? PLAB, 1-day exam. But over here, these are the steps, right? So step 1, step 2, and step 3. Previously, this step 2 was also having 2 parts. Step 2 CK and step CL. Clinical knowledge and clinical skills, CS, clinical skills. Now this has been removed from step 2, but it is merged into step 3. So they have not eliminated anything. It is already there, right? But it is into the third part. No worries. Step 1, step 2 CK, and then the third part, right? That's how it goes. Is it same for every student like in India? No, it is not so. Here, the partially, it happens like if someone has passed, let's take it on another page. So here is the group of MBBS. If someone has passed from US or Canada, then is this exam for them? USMLE? No, it is not for them. It is not for them. For them, it is a different exam. This exam is only for IMG, International Medical Graduates, right? That is International Medical Graduates. That is those who have done MBBS from anywhere in the world except US and Canada, right? So these are the medical graduates. So either a medical student or someone who has already passed his MBBS. Now this point is important. Medical student, when we say medical student means, can you appear for USMLE step 1? Yes, you can. You can. Even if you are in second year, yes, you can, because it is very much clear that a medical student can appear, right? So they can appear for USMLE. That's where I'll show you that if you are into second MBBS, you can appear for step 1 after your second MBBS. Deliberately I'm telling that it is after second MBBS, right? I'll come to the reason within short while, but say I would insist that after second MBBS, plan for it, and you can do it after second MBBS. Plan, right? Achha. So we learned this much, that USMLE is compulsory. You are doing MBBS from Georgia, you are doing MBBS from Kyrgyzstan, Kazakhstan, from India, you have to appear for USMLE, right? Next, what is this step 1? What is this step one? I told you that this is the exam. This is the step one of USMLE, which will be appearing, which you should and you can appear after second MBBS. The idea is that why we are planning this after second MBBS, because once we know that, okay, this is what will be asked, you can start preparing right from the beginning. As I said, that medical is like marathon. It's not like a sprint. Okay. So step one, in which anatomy, well, that's fine, right? Physiology, again, not bad, right? Biochemistry, yes, we learned that thing into our first MBBS. So far, so good, right? But then comes two important things which we normally don't learn. This is behavioral science, right? Behavioral science and communication skills, right? This is communication skills. Plus, you'll be asked about pharmacology, but the beast is pathology. As such, pathology is a long subject, and over about 45 to 50% of the questions they'll be asked from pathology because it is a very strong foundation. Now you know that because these one, they are our first MBBS, but rest of the topics, rest of the subjects, they are of second MBBS. So that's why if you have planned the things properly, it becomes much easier after you clear your second MBBS, appear for step one, right? How this exam would be? Very interesting exam. This is 1 day exam. Right? First, know about that how the exam really appeals you, how the exam really looks like. Then we'll go into the detail of its step. Right? First, we understand that how is the exam. 1 day exam, 8 hours, 8 hours, 8 hours of exam. Now, USMLE is always asked in the form of blocks, right? Blocks. This is the criteria. This is the concept. Blocks. So this block is what? Block is 60-minute duration. 60 minutes, and it is called a 60 minutes block. So for 60 minutes, one exam would run, then break. Then again, the second exam would run, then break. So such 7 exams would be conducted in 1 day. So 7 blocks of 60 minutes, that comes to 8 hours. Add 1 plus 1. This is the 1 hour break. This break can be taken only in between the blocks, right? In between blocks. What would be asked? In this, there would be 40 questions per block. 40 questions per block, right? So total 280, 280 questions on that day. 280 questions, right? Now 280 questions. Let's look at some of the possibilities. You have started. This is the block number 1. You have started. This is 60 minutes. You have started answering, right? And you finish your 40 questions by the end of, let's say, 55 minutes. So then what about these 5 minutes? Well, that 5 minutes is break for you. Take a break, right? So this would be acting like a break. And once again, the second block starts. So that's how one after the another blocks will keep on running. In between, you can't take any break. Once the block starts, it has to finish. Any overtime? No. This is strictly 60 minutes. And in 60 minutes, 40 questions are asked. by any means, if someone has answered 38 questions, right, and the time is up, so bus, that's it. He or she has to score from those 38 only. Last two questions, right, which were over there, missed, gone, right? So this is how exam will go. This exam would be comprising of MCQs, right, multiple choice questions, but there would be few short answer questions. There will be few short answer questions, there will be few long answer questions, but everything will be in the form of MCQ. What does that mean? You might be given a scenario sort of thing, right? You might be given some x-rays, you might be given some images, and then questions will be asked from that, and then you have to find out that which one is the correct answer. Right? So first, that's the first one, right? This is step one. This is step one, right? In step one, this is what is asked. On to the step two. And as I said, that in step 2, previously there were two parts, CK and CL. Now it is just one. So step 2, CK. CK stands for clinical knowledge, right? It is clinical knowledge. How much you know. In this, what would be asked? Everything. What would be the criteria? The criteria is, can you diagnose? So your diagnosis, your diagnostic skill, that would be assessed, diagnostic skill, right? Plus there would be something asked about the treatment, something about treatment, plus legal or ethical issues, legal or ethical issues. On top of it, also plus patient safety, right? Patient's safety. All these questions, they can come, right? This is step 2 CK. In this also, 1 day exam. This exam is of 1 day, but 9 hours. The moment I said 9 hours, immediately you must be telling, okay, that means there would be 8 blocks and each block would be of 60 minutes. Yes, you are absolutely right. 60 minutes, right? This is a 60-minute block, correct? And again, 40 questions per block. So how much would be the total? 8 4s are 32. So that is 320 questions. Slightly change. They asked 318 questions. So in 1 or 2 module, there would be deduction of just 1 question here or there, right? But that's how it goes. Rest, absolutely same, right? Absolutely same. That we have got break of 1 hour, right? We have got now the break of 1 hour, and that 1 hour can be utilized in between the blocks. As you progress further, there comes the step 3. Now step 3 is to be given in USA only. So your preparation is like step 1 and step 2 CK. But still you should know that what would be asked into, say, step 3, right? Their purpose is 1. Step 3 means they say that, are you ready? They want to see your readiness for, now into capital, unsupervised practice. Your readiness for unsupervised medical practice. Can you really handle the patient independently without anyone's help? Right? Unsupervised means this. There is no one over your head, right? You have to manage the whole show. For this particular exam, this is how it goes. There would be 6 into 60 minutes block, right? 60 minutes block. This is fine. 38 to 40 questions they are asked per block. So that's the number 232 questions in total they are asked. Right? So that's your day one. Day one, quite a pleasant day. Right? And again, this is 7 hours exam. And when we say 7 hours exam and 6 blocks, so that means there is allowed break of 1 day, 1 hour, right? 1 hour break allowed. This is day one. Day two is, this is day two. Day two is comprising of two things. And collectively, the whole idea is computer-based case scenarios. Computer-based case scenarios. That's what is done. And in this, you'll be asked about the diagnosis, you'll be asked about the management. All those things they are asked. How much? 9 hours. The exam is of 9 hours. 9 hours means 8 blocks. But wait. Over here, this is a small change. 30 questions per block. 30 questions per block and such 6 blocks. Such 6 blocks are there. But these blocks are of 45 minutes. 45 minutes. Right? So it means something bigger is yet to come. True. So this is where 180 questions are asked. 180 questions. Right? But after this 45 minutes, there is a plus. And that one is when the cases will be shown to you. Cases. Right? And all these cases, they are computer based. So here you are given 10 to 20 minutes per case. This is what is asked. And what they say that it is the day one, it is foundation of independent practice, right? And day two is like advanced clinical medicine. So they'll be asking questions, plus there will be cases, and that's how, say, the complete package goes. Got it? So I'll just write that this one, that is called as foundation of independent practice, right? Independent practice. That's day one. And in day two, right, day two, that is when advanced clinical practice. Pass. Right, this one. And in day two, yes, we talked about it, divided it into two parts. And these parts are one in which there are questions and second in which there are cases. Right? And 13 cases and 180 questions. 180 questions and 13 cases. Right? So that's step 3. Right? Step 3. Once you have cleared this, once it is cleared, in which countries it is valid? Right? Its validity is not only in US and Canada, right? Obviously US, Canada, but it is valid also in Australia. It is valid in Australia. It is valid in UK. But someone might ask, in UK there was PLAB? Yeah, there is PLAB, right? You clear the PLAB, you work, you practice in UK. But say if you have cleared USMLE, you are allowed to do practice in UK. Similarly, DHC, Dubai Healthcare City, right? DHC is Dubai. Yes, it is permitted. Then Israel, Ireland, New Zealand, right? Israel, Ireland, Ireland, New Zealand, Qatar, all these countries, right? They do respect the USMLE and obviously India. Acha. Now let's start our process. You want to appear for USMLE. What should be the first step? The first step is get your number. Get your ECFMG number, right? ECFMG. Right? This is Education Commission of Foreign Medical Graduates. So we need to go to their portal, and over there you need to apply for one important thing. And that important thing is, even if you are in first MBBS, you can take it, and it is necessary. Right? You need to get your number. Right? Now again, I said that it is only for the IM international medical graduates. You need to get a number, and that number is your identity. It is ECFMG number, right? So it's you have to fill a form that is called as the form 186. It is the form 186. This is your certification of identity. This is your identity certification of identity. And this number is permanent. Right? This number is permanent. So even if you are taking it into, say, first year, no worries. It is permanent. For whole life, this number will remain same. It comes at a cost, right? Remember, I'll also be mentioning the cost. It comes at a cost $160. $160. Where should you apply for this? On the portal of ECFMG. So it is ecfmg.org. That's the portal. Right? You have to fill the form, right? That is form 186, and then within the span of 2 to 3 weeks, they give you your number. Okay, let's see this. So here is the portal, right? This is ecfmg.org, and same this, right? This is the home page. Provision of USMLE performance data to international medical schools. ECFMG provides eligible international medical schools with individual and aggregate data on the performance of their students and graduate who apply for ECFMG for USMLE Step 1 and USMLE Step 2 CK, not Step 3. Step 3 is to be given in USA, right? And here it is, as you go in, these are the online services, and this is where you will be asked for USMLE identification number. The number which is, it's an 8-digit number. So here it is. If you forgot your password or this or identification number and went to request one, click here and see here. Once you click here, that's the form. That's what you have to submit. You should just go read through it, click next, right? And they'll be asking you. See, this is not a difficult form, right? You'll be asked about your basic details, but they'll be asking you one important question which you'll miss in this, and that is what is called as the femur number, right? What exactly is your femur number? You might be excellent into your studies. Sometimes the trouble is different. What if your college is not registered under WDOMS? Right? Now what is that? So ECFMG, that's the portal where you have to register for your identification. Register. You have to register for your identification. That is called as Form 186, and this form is to be filled and notarized. Right? It has to be notarized. And then you have to submit that form online. So far, okay. Is there any age limit? No age limit. Right? So even after any number of years, you want to appear for this, sure, go for it. Age limit? No. Right? But yes, that is definitely there, that you should be officially enrolled. Right? You should be officially enrolled or graduated from a medical school, and this medical school should appear into WDOMS, World Directory of Medical Schools, right? So its site is wdoms.org. Okay, your college is there, but what else? Well, we'll just check it. You go over there, and as per your medical school or medical college, right, there would be a number which will be displayed over there, and that's called as the femur ID. Femur ID. This number is to be mentioned into your USMLE ECFMG registration, right? Like say PLAB, IELTS, or test of English as foreign language, TOEFL. No, nothing is needed. Nothing is needed, because in step 1 only they are asking for the communication skills. So that thing is done, right? Now let's see where this femur number is, right? We got, once again, let's pull up this, and this one is wdoms.org, right? In wdoms.org, so here it is, right? All the details, and we just click on the home page, and this is search the world directory. World directory. So many options are there, so you just can't miss it. Right? Say for example, country, and let's say I want to search for my college, right? Whether it is over there, right? So we go for India, right? Medical school name, right? City, let's put it Ahmedabad, right? Now this is interesting, operational. Sometimes it happens like you pass from one medical school, and for some reason after certain years it is non-operational. But whenever it was operational in past, was it a part of WDOMS, World Directory of Medical Schools? If it is, so yes, because you graduated from there, you are allowed to go for USMLE. So let's say operational, yes, it is operational, and we just search. So here it is in Ahmedabad, 1, 2, 3, 4, 5, 6, 6 medical colleges. And here is on top, this is BJ Medical College, Ahmedabad, right? It is there. I just click on this college and the details are there. But here it is. This one is the femur school ID, right? F0001216. That's the femur school ID. This is the number. This is the number which you have to mention into your ECFMG, right? So that's WDOMS, right? All the details of the colleges, they are available over here. And clearly, if it is not here, so then there is trouble, right? Whatever anyone is telling, but if it is not appearing over here, so then it is a genuine trouble. You won't be able to appear for, no way you will be appear for the USMLE if the college is not here. So let's say this is Georgia, right? And say we just remove this also. We just give the how many colleges in Georgia they are affiliated or they are part of WDOMS. We just give search, right? In Tbilisi, right? In Tbilisi, and this is in Kutaisi. right? So these are the all the list. So this is where you will search whether this is European University or Georgian American University, all of them, right? David Tridliani. So just click on that and you will find that yes, that is a femur number, right? So that's a femur number which is present. Actually, over here you'll be getting all the details of the college also, right? Whether school website in Georgia in English, right? Got what is the contact information. This is the program details, right? All the details, right? Then sponsor notes. The point is, this is the site. This is the place where you get all this piece of information free. So, so before taking admission, check it over here. Your college should be appearing at this point, right? Okay. Next one. Next is, so you have got this wdoms.org and now you are ready, right? That your college is enrolled. So that is good. So we have studied properly. So this much we have done. That is, we have got our ECFMG number, right? That we have obtained. We applied also. We checked our college also. wdoms.org. All good. And then we started studying. Study complete. And we want to appear for the exam. So now comes scheduling the exam. Right? It should not be very difficult, but you need to know certain things in this. It is again not as simple as that. You need to know because rules they keep on changing. That's why I would try to keep you updated as much as possible. Right? First of all, the exam fees. Yes, these are bit costly exams. $985, that is the exam. But they would charge something extra. Right? They would charge something extra because you are not appearing from US or Canada. You are appearing from international. So this is what is called as the international surcharge. Right? This is the international test delivery surcharge. This is the extra charge which they'll be taking from you. And this is another $185, right? So total would come to $1,170. Considering today's rate, right, about 84. So that comes to about 96,000 rupees. 96,000 rupees, right? This is the exam. Fine, you set the exam. 3 months is the eligibility. So what is that? As such, so we have set the exam ki chalo, we'll be appearing for the exam on 10th of June. But for some reason, you want to reschedule it. Right? Rescheduling charges. That means you are allowed to change within the time span of 3 months, right? Because 3 months is the eligibility. So rescheduling charges, they are another $604, right? $604. And you have booked the exam, but now preparation is not up to the mark. We thought that will complete, but somehow it is not. It has not happened. Then you can extend. So this is what is called as the extension of eligibility. Extension of eligibility. That is $100. And this can be done only once. Only once. You can reschedule only one time. Now, what about the attempts? Now, don't I feel bad about this here because every attempt is so costly. Right? But still, now there are four attempts allowed. Four attempts, right, per step. Four attempts per step. Previously, that is before July 2021, six were allowed. Six attempts were there. But see, there is now a very specific pattern for this. Three attempts, right? Three attempts are allowed in 12 months. So in the span of say 1 year or the 12 months, three attempts are allowed. But for some reason, who has flunked even in the third attempt, so then from the last day, the day on which he or she has appeared, calculate another 12 months. This 12-month is a cold period. You can't appear for any of the exam, and then after that you can appear for fourth attempt if needed, right? Chalo, someone has this passed. So if passed, but what if we feel like nahi, our score is less? Score is less. Let's appear for retake, right? फिर से देते हैं exam. Not allowed. Not allowed. You have passed in step one. Even if it is a very borderline score, no worries. Appear for step two. Proceed. Right? Usually results they take about 2 weeks, 2 to 3 weeks. 2 to 3 weeks, you'll get the result. Right? So that is step one. Now, after step one, what would happen when the result comes? Well, when the result would be declared, score, your score would be displayed for 1 year on website. Right? You will be shown your score. Now you say, as such, no one believes. You will require a transcript. There is no point in say sending messages or fax or email or telephones to ECFMG. No, they are not responsible. They won't be sending any fax. They won't be sending any email. They won't be calling you, right? No telephone, nothing. Everything is online. You want a transcript, right? Transcript is that piece of document where everything would be mentioned about how you appeared, what was your score, how many attempts, everything with date, with all details of yours. So this is what is called as the form 172. Form 172. This form 172, it is for individual requirements. Individual means it is your requirement. You want that I want to have a piece of paper on which all the my subject scores and everything is to be mentioned. That is form 172. You have applied for some internship, right, or some medical program, and now that company, that institution wants that, okay, what was your transcript? So that is called as form 173. So this is by an institution. So in that case, this is what is called as the form 173. Right? Again, this is also, right, let me mention, it is not free. $70, right, at every stage. Yes, they will be asking. Now a word of caution. Let me write it with red color. Unfortunately, no, it won't be seen very properly. This is okay. All right. So if someone has not passed and he or she feels like let's go for score recheck, right? They give you the option. Score recheck. Score recheck is not done manually, right? Well, let's be very clear. And what I'm writing is, yes, this is a fact, right? It is not checked manually. It will automatically be checked by the computers, right? And till date, right? Till date, results have never changed, right? Result Results have never ever changed. It comes to same way that okay, this is your the same score, whatever the score which was given to you, that is correct. Finished, no arguments. And plus, this is to be done within 90 days. Within 90 days. But as such, results they never change. So within 90 days, in case if someone is very much enthusiastic, no, I want to go for recheck, well, that is what is called as the form 250. It's 265, right? 265, yeah, 260, 265, costing at $80. But this definitely is like a waste of money. Results, they never change. Right? So but still good to know. So that's how the exam proceeds. So step one, right? In case of step one, which we discussed at length, right? In step one. Step two, same charges. Same charges. So same way, the exam fee $985, right? Plus there was, you remember, surcharge was there. Surcharge of 185, 185. Same style, the total would be say 1170, right? And then there would be verification, right? And that verification is done by state medical licensing authority. That means in whatever the state you want to apply, right, that state would check your USMLE transcript, right? So that is the state medical licensing authority, right? They would say that are you a genuine person who has cleared the USMLE? So for that, this verification, so that comes at $66, right? So see how the whole say USMLE exam is planned. Interesting is step three, right? Though by the time you will reach to this point, there might be some changes into that, but step three is in USA only in 2022, and this one is 2023 now. For that, first previously the charges were $895. Now it has been increased to, right, 950. How much time you have got to complete? The day you give your first exam, right? And the day, this is like step one and this is like step three. At the most, 7 years are given. 7 years to complete USMLE. To complete USMLE. 7 years are allowed. Right? And then within 7 years, one is supposed to finish it. So this is how the USMLE goes, right? The entire path, everything over here. The point is, how should you really plan? Simply, if you want to go for USMLE, start dreaming about it. It should be crystal clear in your mind. Because these exams as such, they look easy. But remember, say it is a first exam and then one after the another, those blocks, they are coming. Right? right? And then you appear for step 1, then you appear for step 2 CK, and then the step 3. Long journey, right? But it is worthwhile. It's worth it. Because the amount of satisfaction, the amount of money, and the amount of work, etc., what you get over there, right? The money spent on USMLE, you'll be able to recover within few days, right? So not to worry much about it. If you are passionate, if you can work hard, go for it. Talked about transcript, talk about those scores, right? How the exams, how many questions they are asked, etc. So this is about USMLE. Anything you want to ask about it, you can either send it on comment section, or you can send a mail to me, or you can even send it over here, the number which is shown on the display, right? So even over there also, you can definitely send your queries. Anything you want to ask right now? Go through this entire process very properly and then plan for it. So I would say that by the end of second year, right, appear for step 1, so that by the time your final MBBS comes, you are very much ready for step 2 CK, right? Clinical knowledge. And then the step 3. So this is how we need to plan for USMLE, right? Tomorrow morning at 11 o'clock, we'll be meeting for the plan, right? The action plan, how to prepare yourself for this medical studies, so that there is no frustration. Entire thing is like, it should go like a pleasure. Important from the perspective of the student, also important from the perspective of the parents, right? So thanks a lot. Thank you so much. And we meet tomorrow morning. Okay. Thank you and see you soon. Bye bye.